My parents are doctors, and I was exposed to them. And also, I felt as I was growing up that it's probably a better choice for me. I'm a neurologist, and I specialize in movement disorders. Our specialty encompasses a lot of hyper and hypokinetic neurological problems. We see a lot of patients with Parkinson's disease, essential tremor, and other types of tremor-involved disorders. When you deal with chronic disease, it's very important to follow up the patient longitudinally over many years. That helps to prevent a lot of complications. You can forestall a lot of problems, and you can adjust the treatment as the chronic disease is evolving over time. In our movement disorder group, we cooperate a lot with our neurosurgeons and with our psychologists. So we really work as a team. So we get to talk to them, we get to interact with them on a daily basis, and that helps to break down barriers and to accomplish our tasks much faster and with greater precision. So it helps us to assess our patients that present for DBS surgery. It helps to select the best candidate to discuss the problems that might arise. So when you see a patient who comes in with really, let's say, really hard to control essential tremor, the person who has had the disease for several decades, the person who is not being helped by oral medications anymore, the person whose life is greatly impaired by tremor to the extent that the patient can't drink from a cup, can't eat by himself, can't work at all, and the quality of life is greatly impaired. And you see them, if you fast forward a year from there, 6 months from there, after appropriate assessment, they go through DBS surgery, and they have 80–90% improvement in tremor, and they can do things that they couldn't do previously, and that's very rewarding to see. I have a family, I have a wife, I have kids, so I try to spend more time with them, taking care of the household. My kids are still young, so I have to invest effort in them, but that's what I do when I'm not at work.